Welcome back, everyone. You're watching We Heart Therapy. I'm your host, Dr. Belle Bugatti, licensed marriage and family therapist and certified EFT supervisor and therapist here in fabulous Las Vegas, Nevada. And some of you might know me as Dr. Belle. And I have a series, EFT Talk. And I'm super, super excited to be bringing back to our podcast is Dr.SueJohnson. She is a pioneer and an incredible woman who founded the model of emotionally focused therapy. She's written many books. She's created this fabulous model of counseling that is well-researched and has earned the gold standard of couples counseling. And we're welcoming her back. So if you've been watching my channel, you might have seen our interview from a few years ago where we discussed why we would want to use emotionally focused therapy as our model for couples counseling. And as we've learned over the years that EFT is perfect not just for couples counseling, but for families and individuals as well. And a lot of folks didn't know that they can use emotionally focused therapy for their individual clients. And so that's what we're going to be talking today. And we're going to be talking to Sue directly about the use of emotionally focused therapy and how it's been adapted to work with one person in the room as opposed to two. And so let's just welcome back Dr. SueJohnson. Sue, thank you so much for being with us today.
Oh, most welcome. I'm delighted to be here.
So do you want to kind of tell everyone a little bit more, like a brief, maybe intro about emotionally focused therapy and the research up to this point, what's earned it the gold standard?
Oh, well, for over 30 years, I and my colleagues have created and researched this very specific particular way of helping couples create not just better relationships or, more friendly relationships or relationships less fraught with conflict, but helping them build secure, loving bonds, which is what, as human beings, we all long for. It's wired into our nervous system. We're wired for connection. This is what we're built to look for, to seek, to hold on to. Those bonds are our biggest resource in life. So we've sort of been obsessed for the last 35 years of, understanding those bonds, understanding what makes a good relationship, cracking the code of love, if you like. And we've plugged into the work of John Bowlby, who started all this in the 1950s, who looked at the bonds between mothers and infants. And it wasn't really until the beginning of this century that you were sort of allowed to talk about bonds between adults. This was all about mothers and infants. And then social psychologists and neuroscientists and clinicians like me started to realize that, wait a minute, John Bowlby said that our need for bonds and our desire to bond goes from the cradle to the grave. This doesn't end when you're 12 years old and you become a bit more independent. This need for this safe, intimate connection lasts through your whole life. Let's look at it in adults. And we started working with couples in the 1980s and working with emotion and working with helping people talk about their deeper needs and feelings in a way that pulled their partner towards them. In a way, our clients taught us to do that. We sat in the room and we listened to our clients, and EFT comes from observing hundreds of couples get stuck, fight, get caught in distance and disconnection, and then observing how to help them move towards each other, help each other feel safe and reach for each other and create these deep bonding conversations. And so, we learned from our couples, we now teach it all over the world. We have affiliated organizations, 91 actually, they keep going up, 91 affiliated organizations all over the world where therapists come together to learn this model of helping couples. And I wrote a book for couples called Hold Me Tight, which is, I don't know how old, 10 years old now, and it's still selling like crazy. And started all kinds of programs for Hold Me Tight to teach for couples to do these bonding conversations in their own lives. And all through this time, we've also continued to research everything about this intervention, everything about its outcome. We have over 20 positive outcome studies. I think we're the only couples intervention that has positive follow-up studies where we can show the changes we make last. Yes, they do. Because once you learn how to have a bonding conversation with your loved one and you both feel safe and precious to each other, you don't forget how to do that. Your brain just holds on to it. So we have good follow-up, and we've done research on how having these bonding conversations changes your brain, changes how you respond to threat in a video, in a brain scan. We've done research on the process of change, exactly how you change relationships. So, at this point, I think it really is fair to say that from a research point of view, the last 35 years puts us as the gold standard of couples therapy. We know how to create these corrective emotional experiences for couples. We know how to go to the heart of the matter. We're on target. We know how to make a difference. And we train therapists all over the world. So EFT at the moment is very well established as a couples therapy. We have an online hold me tight. I always forget, what is it? What is it? Hold me tight online. Hold me tight online. People can. The video is getting a little old now. We need new couples to come in. The clothes look a little bit dated, but basically it's still really a good program. It's used by the US military, by the Canadian military. It is a program by the big hospital in Canada's capital for cardiac couples. And there's still a huge research project going on there to show that it works, not just for couples to be happier and closer, but it works because when you're in a good relationship, you do other things like take care of your health, go to the gym, you're not stressed out of your mind, you remember to take your heart pills, so it's going to impact their physical health. And so it's alive and kicking and doing well. And
there's so many good aspects of EFT, and I just want to catch right in this place. So some of the really amazing things that you're saying, Sue, and basically I also want to highlight what sets EFT and the research on EFT apart as the gold standard from other models that are evidence-based, is that some of the other evidence models have researched distress and come up with a perceived solution to that problem, but not actually tested their solution to see if it does what it says it's supposed to do, whereas EFT has.
Oh, evidence-based is a funny phrase. It's thrown around all over the place. Yes. I don't know what it means anymore, but you're right. For us, what it means is, well, I tell you, for me, what it means is as a scientist practitioner, first of all, if you want me to believe what you say, you have to show it to me in a tape. Mm-hmm. If you're just going to stand up and talk about it, that's like talking to me about Snow White and the Seven Dwarfs, as far as I'm concerned. If you don't show what you do, basically, I don't believe you. Mm-hmm. And secondly, you have to show, for me, that this thing that you do, that you can do a proper, rigorous research study and show me that it has actual impact, rather than just time or something. And if you're not willing to do that, then personally, I think it's naughty to say that you're evidence-based, because that phrase doesn't mean anything. And the general public think when I say evidence-based that it means that I've got studies. That's not true. It's true for us. And we're very proud of it. And
it's well researched. We've actually researched EFT. It's
researched everything. We've even researched whether our trainings make any difference to therapists.
Right. So we have on all levels, we've actually researched not just couples distress, but we've researched the model. So you developed emotionally focused therapy and then applied it. And then we studied the interventions and its uses. and discovered whether or not the model actually met its goals and its targets in helping to be able to create lasting change, and found that it has, which is what sets EFT apart. So we actually know that our model works and how it works and why it works because you've researched the heck out of it.
That's right. And I think what's one of the studies that I'm most proud of, and that leads into where EFT is now, and maybe what we're going to talk about, which is using EFT for individuals who are depressed, anxious, or have PTSD. One of the studies we did was we took distressed and insecurely attached couples who said things like, no, I don't trust my partner. No, I don't confide in my partner. No, my partner isn't there for me. No, I don't know how to reach for my partner, or I'd never do that. Or if I reached for my partner, he wouldn't be there. She wouldn't be there. We took these insecure couples who weren't just fighting, but were feeling emotionally isolated, right? Which is very, very painful for human beings. We're built for relationships. And we showed that when we had these bonding conversations, we could create more secure attachment, which means that we could create this deep sense of bonding that has been shown in thousands of studies on attachment over the years, literally thousands all over the world, this deep sense of safe connection with another human being and bonding that allows us to thrive and that allows us to know who we are, trust other people, that we could create this sense of security. And this is an individual variable, right? We looked at couples, we looked at how they interact, your interactions change, your brain changes. We looked at
couples are, after all, made up of two individuals. Right?
Exactly. But in this study, we actually looked at individuals' inner sense of deep connection and trust, whether they could rely on this person and reach, whether they could trust this other person with their vulnerability and reach for this person as a resource. And we found that we could, and not only that, but it stayed. And some of these research results, they blow my mind. I believe in them before we start to do the study, but I'm always prepared to be proved wrong. And they blow my mind when they come out exactly as we expect. This is totally rewarding. But then I don't know how to stand up in the world and say, hey, everybody, this is really huge. Do you understand what happened here? But basically, because we had such impact on individuals' sense of security with themselves and with other people, which we know, again, from thousands of studies, this sense of inner safety and security impacts your mental health, your physical health, your resilience. It protects you from depression, from anxiety.
That's Attachment Science 101.
That's Attachment Science 101. So after that study, I became more and more focused on, you know what? We've spent all this time doing a few little things like trying to crack the code of love and trying to show people what a good relationship looked like and how to have one. And that's been kind of kept us busy for a while. But this is really interesting because all through the years, most of my close colleagues and me, while we've been doing couples and staring at thousands of tapes of couples and doing all this research, we've also been doing individual therapy, a la EFT. And we've been working especially with trauma. I thought, well, I know everyone does this and I do that, but we never talk about that. And look at these amazing, and when I change, one of the wonderful things about changing a relationship is when you change a relationship in this particular kind of way, the partners start to grow each other. They start to, the interactions become so safe and so holding and so positive that the individuals start to flower and they become less depressed, less anxious, they have less PTSD symptoms, they become happier with themselves. So I thought, well, it's time that we recognize the fact that we have this impact in couples therapy on individuals. We've all been working with individuals for years. It's time we started talking about EFIT, emotionally focused individual therapy. And of course, we have a study going and it's done, but COVID slowed it all down. So the results.
Let's talk a little bit about why that is. And I want to make sure to mention too that that in the EFT studies currently, you've also studied EFT with bulimia, PTSD, heart patients. I mean, you've studied the use of EFT across a variety of different client presenting issues and demographics. So we know, and again, it comes back to attachment science 101, is that that attachment is a universal human need. It's an existential science. And, you've always said, all behavior makes sense when understood through the lens of attachment. So basically, attachment is the science about how we human. And that's why it is applicable. And again, folks, it's not a different model. We're still talking about EFT.
Yes, we are.
Yeah, we've just adapted it because there are some therapists out there who don't see couples, who just work with individuals. So when we say EFIT, we're meaning that the strategies and interventions have been adapted for working with a single person sitting live in your room, as opposed to two.
I want to say something about that. The bottom line is, if you believe in attachment science and you see us as social bonding animals, you never have one person in the room.
Exactly.
As Irvin Yalom, who's one of my favorite colleagues, as Irvin Yalom says, I haven't got it right now, but basically he says, the job of the therapist is to get to know the cast of characters that every client brings into the room with them when they come in. We all have this cast of characters. I'm very disturbed to still have to tell you at my age that at certain points in time, when certain triggers come up, my English working class, very judgmental mother is alive and well in my right ear. And she always says amazingly negative things to me. Okay. And somehow my body still responds. I just can't believe it, but it does. Okay. So when you have one person in the room, they bring in with them the key dramas in their lives, the emotional dramas with other people where they have defined themselves, where other people have defined them. They bring in with them the key dramas where they learn to deal with their emotions. When I feel vulnerable, I must shut down. I must shut it. I must close down, shut people out. Or when I feel vulnerable, I must scream and yell and catastrophize. If anybody's going to hear me at all, I must scream and yell, right? Or whatever. We learn how to be with ourselves, how to see ourselves, how to emote.
Or how to not see ourselves and
not see ourselves and emote in these dramas. And so your individual clients bring these in with them.
So let's catch folks up. So while you're talking about our individual clients and the cast of characters, let's do a quick review of Attachment Science 101 as applied to individuals. As you made so many good points. In Attachment Science 101, we know attachment is not just the science of bonding. That's like a very narrow view. It's the science of how we behave and why we behave, motivation, emotion, how we learn to regulate or not regulate emotion. And attachment is the lens through which we experience reality, how we learn to see ourselves, so develop our self-esteem, how we learn to view others around us, whether we see them as trustworthy, reliable, or having a hidden agenda or not to be trusted. And so all of that comes together, though all of those are inextricably tied, which develops, again, how we feel dictates how we behave. And, so whether we know that people with secure attachment have more ability to regulate their emotions, and they're more likely to make good decisions and good behaviors, versus those who don't have secure attachment are more likely to be dysregulated and struggle more with the behaviors, having problematic behaviors and coping strategies. And we know anxiety, depression, these are all both emotional processes, and also talk about an interaction process, because we know none of these are made in isolation, right? If anxiety is all about worry, I just say anxiety is a highfalutin word for worry, But at the attachment end of it is when there's a bunch of worry, do we feel like it's all up to me and I don't
You
have
feel
people
alone.
Yes. No one to lean on and rely on or to trust that I could delegate to. And so I have to carry this all, or depression, which I have an EFT video on, pain turned inward, that's not shared outward. When you really know attachment, I've never come across a client who was clinically depressed that had positive self-talk, again, how we see ourselves, that believed they were worthy or lovable. I'm hard pressed to find a client that felt worthy and lovable and had depression.
So it's very interesting. One of the clients I'm working with right now that I'm using for teaching EFIT, she has been depressed for years, and she uses this label, and indeed she actually has about 6 labels now. I can't believe it. Her family doctor seems to change his mind every time he sees her. So she has about 6 labels, all of which don't make any sense to me. And so, but when we actually go into the emotion she feels, when we slow everything down, which we do in EFT, whether with couples or families or individuals, when we slow everything down and we unpack the emotion and we go in there with her, it's very interesting because she doesn't like doing that. She says, I don't feel, it's not my thing. Okay, this is what she says to me at the beginning. I say, oh, I understand, yeah. But anyway, when we slowly go in and unpack it, when she starts to walk around it because she feels safe with me, and I've got a map to these emotions so I can help her walk into them and make sense of them, what she comes up with is this depression. Actually, it's sadness. And if you look at that sadness for a moment, what she comes up with is, I'm heartbroken. Ah, that's different from, I'm depressed and my doctor says I'll probably always be depressed and that's just the way it is and it's probably my genes and I'm just a depressive and this is the way I see things and I'm depressed and there's nothing I can do. No. You're heartbroken. And then we put it in context. Of course, she's heartbroken. Her experience growing up in her family until she fled her family at about 20 years old was that she was completely abandoned, totally unseen, totally unsafe, and that she was abused physically and sexually by her brothers, and nobody saw it, listened to it, cared about it. And even when it became explicit later in her teens, and she thought, now people will respond, now my father will respond. No, because nobody wants to deal with that reality. So it was minimized and dismissed. And so, yes, she's terrified to trust other people. She's alone. When she gets depressed, heartbroken, she goes off in her head. She shuts everybody out. She looks at all these images, right, of her as a little child under the bed, her bed in the dark, waiting for somebody to come for her, right? I mean, she starts to be able to go into these experiences and name this big abstract thing called depression in real concrete terms that make sense. And when she starts to do that, of course, she starts to change. She starts to, start to grieve. And I, as an attachment-orientated therapist, validate her needs, her vulnerability. I validate her courage in surviving at all, in trusting me, and she starts to move and grow and change. And this is, we still use attachment science. We still use the map to people's longings and needs and fears that are taken from attachment. We still use all the techniques that we've honed over the years working with distressed couples and the 2 individuals in those distressed couples. It's still the same. The issue is, in some ways, it's a little easier because you don't have a second partner in the room interrupting you. But in other ways,
it's harder in other ways.
Well, in other ways, sometimes the second partner can be useful, like saying things like, I do want to be with you.
Yeah.
However, unfortunately, in distressed couples, sometimes the second partner isn't useful. They say the opposite of what you want them to say. But the point is, the real difference in EFIT is we go into the same dramas, in the same emotions. We have the same way of going into and through emotions. The difference is that instead of saying, could you take this incredible new feeling, this, you're so brilliant, could you take this new formulation that your heart has been broken and that you haven't been able to grieve that, right? Could you take this and could you turn to your partner and say, instead of doing that, we say, could you close your eyes? And of course, this client says, first of all, says, I don't want to close my eyes. So, that, because you're right, she doesn't know what she's going to see. But we get to the point where I say, could you close your eyes? And could you see that little girl? How old is she? She's 8, right? Could you see her under the bed with her back against the wall in the dark, under the bed with her favorite toy, waiting for her brothers to come to her? Could you see her? And at first she says, no, I don't want to see her. No, I can't see her face. And then we get to gradually, oh, it's too hard. I understand. You don't want to see her. Then we go, and then gradually we get to, I can see her. Okay. What would you do if you were there, the adult, capable person who sought out therapy, who survived, who's got the courage to talk to Sue? What would you do? And she says, I don't know what I'd say to her. I think I'd just crawl in there in the dark and hold her. I say, good. Can you see that, please? Can you see that? And she says, yes. How does that feel? So we go into these key dramas and where these huge decisions were made. Who am I? Who is other people? What do I do with my emotion? How do I deal with vulnerability?
How do I move through the world?
How do I move through the world? We go into
I want to catch what you're saying, Sue, because this is so good. And thinking about, again, folks who are, thinking, hey, I want to learn EFT. And, maybe I've tried other models. So I'm thinking about shopping EFT and why I want to use EFT again, as we said. And based on all the applications already, is there's really not a presenting problem that EFT cannot help with. We know nothing is 100% fits for everybody.
Well, we don't. For example, in couples, we used to say, we won't work with you if you're having an active affair with heroin, because it's going to get in the way of, we can't compete with that. It's going to get in the way of you creating a new relationship with your partner. We won't work with you if you're having an active affair with somebody else, because we can't help your partner feel safe and move towards you. We don't know how to do, we can't do that. But every other kind of couple we worked with. And
even still, we've ended up even adapting those and saying, well, we can only do up to a certain level of work where we're going to help talk about how this affair with heroin or another partner happened and what blocks you from ending this affair and all those
things. Yes, we can do that. What we can't do is take people through to the whole thing.
Right, exactly. But EFT, again, because attachment is the science about how we human. And I think for folks that are seeing clients and only one comes in, but they're talking about, relational problems, it seems pretty easy for them to kind of conceptualize. But again, I think because our educational system has really failed us around teaching about attachment, and they failed to teach us that it's about emotion and behavior also. So folks have clients that come in and have no idea. They lose that conceptualization of seeing a client in context of their social world as well as their behavior. So even if I have somebody coming in for career counseling, we also know through the attachment lens, people with secure attachment are more easily able to take risks and explore. So I might be looking for blocks, like if they want to try for a job that they feel would be amazing, but they're not qualified for, I'm going to talk about where they learn to not take risks, what may hold them back.
And that's fantastic, Annabelle. That's exactly what you should do, because That's right. So you don't just go with the surface of what people say and help them problem solve. They can do that on their own with their phone.
And if they could, they'd be reading it in a self-help book.
Yeah, they could go to Google for that.
They wouldn't need us.
But what you look at is the level underneath that, the process that keeps them stuck, the emotional process. I think the real issue is that as I watched psychology teaching and therapy teaching evolve in my own country in Canada over the years, it seems to me that we've been inundated with information, and everyone feels that now they have to understand statistics and ethics and the brain and down to this. But what has slipped through the cracks, at least in Canada, is there used to be, I went through it as a graduate student. I remember resenting having to take it, which is really funny because of what I'm going to say now. But, it was actually very useful. There used to be, for the students I used to teach at the University of Ottawa, a course that just taught about how to be with your client, how to be with people, how to connect with them, and how to go underneath that surface level into the deeper emotions and look at the whole process instead of getting stuck in the problem.
Yeah.
There used to be a course on that. It fell through the cracks. It wasn't considered important. Okay. Yeah. I can't remember what the substitute was, but it wasn't, and I was the only one. I remember the meeting, me saying, excuse me, sorry, no, isn't this the basis for all the things we do in therapy? People, if we don't know how to help people feel really safe with us and see past their presenting issues and problems, aren't we wasting our time? Nobody wanted to hear it. No,
how can they take risks?
No, Sue, you're just, I was always out of step. In any organization I've ever been in.
You were just ahead of the fold, Sue. They weren't ready for your advancements at the time.
They didn't see it that way. I assure you, Annabelle, they didn't see it.
Well, and Sue, you inspired my book on relentless empathy. I mean, that was your word that you coined, and the whole book
I love that title.
Thank you. It's about how to be with clients. It's a whole self of the therapist book. And my opinion is that those who struggle, who don't like EFTs because they struggle with their own emotions and it's easier to avoid, which,
yes,
to each their own, but I from my experience being a supervisor and a clinician, whether it's clients or clinicians, sometimes folks just don't want to go that deep into their emotions because it brings up what's uncomfortable. And, I think society in general is also stoking this as the instant gratification. We just want to move away. We want a Band-Aid, take the quickest, shortest route. So avoidance is very much.
We're not very good at, the idea that if somebody comes to see me, I start off from curiosity, like, who are you? And I don't mean, who are you? Are you a bank manager? Or I mean, how do you live your everyday life? What do you do when you're vulnerable? What do you do if you feel alone? How do you see other people? How do you connect with them? Do you reach for them? No? Oh, what do you do then? Like, how do you, what are your fears? What are your needs? What are your longings? What are the longings that you still have that you can't even talk about? John Bowlby says, all dysfunction is about frightening, alien, unacceptable emotions. And what you do with them, what you learn to do with them, which often we do things with them that just keeps us trapped. I deny them. And if I deny them, they just are waiting for me in the dark. They come up bigger and bigger and bigger and bigger, right? And
we may have clients who come in who struggle in relationships, both romantic, but friendship, family, even with their boss. And so we may look at, where did you learn to not have a voice? How did you learn to shut it down?
That's right.
So we may work with that, how to help them.
And the royal road into all that is through emotion. But the point is,
some therapists can't even be curious about themselves in that place in their own emotion. That's
I get that. But what I think about that, using relentless empathy, is that we as therapists or as clients, will not go into those vulnerable places if we don't have a map to those vulnerable places and know the way out. Yeah. And if the therapist doesn't have a map and know the way out, one of the latest book we put out is just this year was a primer in emotionally focused individual therapy with Routledge with my wonderful colleague Leanne Campbell. We just put that out. It's going very well. But the woman in that book, very traumatized woman that I use a lot in the book, and I lots of transcripts. She's a very intelligent woman, chronic developmental PTSD. She says to me in about session 4, she says, "You're different." And I said, "Oh, I am?" I thought, "Oh, what's going to come now?" Right. And I thought she's going to say, "You've got an English accent," or, "You're different." I say, okay, what's different? She said, "You're not scared of my pain, are you?" And I thought, "Oh, am I? Am I scared?" And I thought, maybe I am. And I said, "No, I don't think I am." And she said, "Well, why aren't you?" Right? Like, because every other therapist I've ever seen is. And I said, "Oh, because wonderful, incredible clients like you over the last 40 years have shown me what that pain's about. And I have my theory and all the research. I have a map to what that pain's about. And all our work over the years convinces me that I know how to be with you in it, how to guide you through it, how to walk through it. And I know that we'll come out the other side. So I'm not scared of it." And she cries.
Yeah.
And I say, and then of course I do EFT. What happens to you when I say that?
And I think you're so right. When we connect the example you're using back to therapist is not, and again, to do EFT well, we have to be able to feel. In order to have empathy, we have to be able to feel, which means our emotional channels.
That's right. You have to go in and say, how would I feel if I was in this client's shoes right now? Yes. What is happening to me in my body? Oh my God. Yeah. Of course she's heartbroken. Yeah. This is such a sad, sad story. So that I can turn and say to the client, and this really matters online, by the way, doing online therapy. We do therapy just fine online. This matters because I can say, "I hear you, Alison, I hear you. And when you tell me about that little girl under the bed in the dark, it just grabs me here. It is sad. It is heartbreaking. You were so alone. You were so scared. Nobody was there. And you decided that you had to suffer in silence." This is one of her phrases she uses all the time. We call them handles into her world. Yes. You decided to suffer in silence. And part of you is still suffering in silence because you can't tell the few people in your world that you do maybe think are safe. You can't tell them about this heartbreak, can you? And so, that makes my chest ache. No wonder your chest aches. And then she looks up at the screen and, sort of does this and drinks her drink 5 times and then looks back at me and says, "So you feel sad too." So what she's saying, you see me, and you've helped me make sense of it. And people in EFIT and in EFT say things like, "Yeah, you got it. Yeah, you're on the money." Yeah, and the other thing is we're fast, we're efficient because we do have this map. So,
but we do have to access. I mean, like we keep saying, EFT is the science of how we human, and to do EFT well, attachment is the science about how we human. EFT gives us a map for how to communicate our pain and distress and reach and ask for what we need. And so you can't do great EFT without allowing your own humanity to be touched. And if you've never had a map for yourself, if nobody's ever helped you through those places, and I have this self of the therapist piece come up with a lot of EFT clinicians that I work with, and similar with my clients, it's like, if I have no map and I go into someone's pain, then it feels like, what's the point? What's the purpose? Because then I'm just alone. So you're just digging up these painful emotions, making me feel them with no good outcome, no love, no problem, no solution to the problem. And
That's right.
yeah, well, I get that. Makes sense.
No, that's right. And we live in a society that invests heavily in the idea of invincibility.
Mm-hmm.
I'm looking at our movies, why is it at this point in history, when there's more uncertainty than there has been for ages, are we obsessed with these movies about super this and super that, and totally inhuman? It makes sense, doesn't it?
You want to hear another irony, Sue, along that continuum, is that humans are always trying to find a way to not feel, yet we keep creating movies about robots that we can't imagine not feeling. There's always some ghost in the code where there's a fluke and they have feelings and emotions.
Yes, that's very, very interesting. I love, that's a good point. But it's so interesting because we have all these therapies out there now, and some recognize emotion more than others, but we have all these therapies out there now, and people I really respect, people like Peter Levine. I mean, I really respect him. I like him a lot. We like each other, but we get stuck because he says things like, why don't you just stay with the body? And I say, Peter, emotions are in the body. That's the way the body takes these body sensations and generates something that we call an emotion. Why don't you let the natural flow happen? Why don't you go with the emotion? Because I can show you that it works. I can show you on a piece of tape, a change event. I can show you the impact of that change event in statistics 3 years down the road. Peter, why don't you go with the emotion? And he says, why don't you stay with the body? So it's like we're all trying to get to the same place.
Well, I don't know if you've noticed too, in Canada, you talked about some of the other models. I noticed in the US, and I feel like it follows the societal trend, is this pressure for instant gratification. So people are looking for models that have a quick fix. And, I continually try to help people know that, there's no quick fix for humanity. Rome wasn't built in a day.
Well, and that's a very interesting point, because it depends what you mean by quick. The lady in the primer, and there's lots of transcripts of me working with her in the primer. The lady in the primer had, from my point of view, chronic complex PTSD all her life. Okay, she'd got to the point where she'd been hospitalized twice for being catatonic. Okay, and she had all kinds of life circumstances that fed into that trauma and maintained it through her life. And now at somewhere like 50 years old, she was really, everything was, something had to give, right? Something had to change. And, and why am I talking about her? What were you saying? Something about?
You're talking about a quick fix, and you said,
right.
What you call
so I worked with her. She'd been basically distressed all her life, right? She'd been high functioning in one tiny little area, right? But she'd been distressed all her life, and she was on some level of PTSD on the scale we gave her. She was off the charts on all the measures of PTSD. Okay, off the charts. In fact, I looked at it, I thought, oh my goodness me, this is the lady that I'm going to try and use the material for the book. Goodness me, right? Nevertheless, I worked with her over a year and a bit, maybe maybe a year and a half. We had 40 sessions, and we gave her that scale again. She was normal on nearly all of them. And the ones she wasn't normal on, she was just a tiny bit, including dissociation, which she was off the charts for in the beginning. So it depends what you mean by quick fix.
And knowing as a more seasoned clinician that 40 is actually pretty quick, but especially for the kinds of distress that you're talking about, what I hear from, I'll say, the word on the streets with the therapist I see is even faster than that, like, within 1 or 2 sessions or a few sessions, less than 10, I would say. It's like come in, come out, almost like people have ever seen that movie Men in Black, where they had that memory flashy thingy where they could wipe your memory and erase it with a new one. I thought, well, if only therapy worked like that, where we could just erase their memory and record it with the new one.
It depends what you're doing.
Yeah.
What you're doing is giving people tips. Therapy is going to be replaced soon by Google robots. So if what you're talking about is giving people tips, like what did I hear the other day from a very famous therapist? If you're depressed, you just sit upright in your chair, you sit back in your chair, and you feel the strength in your body. That's it. Are you joking me? Like you can give people tips, you can give people small little insights where they feel good for a couple of hours. You can give people emotional support, in a couple of sessions. We have evidence that we could change severely distressed couples who didn't even know what a good relationship looked like, and where somebody in the couple was distressed. We have evidence that we really change them in between 15 and 20 sessions. But if
we work on the emotional level, specifically
right.
What you're speaking to is because emotion is in the nervous system, and when the nervous system is activated, when emotion is alive, the body hits record. And that's what we want, is people to start recording new ways of being.
That's a lovely phrase. Can I steal that? I like that.
Of course.
When emotion is alive, the body hits record. I love that. Yeah. That's beautiful. Yes, but I think the point is the modern world has, you're right that we want everything instantly. I ordered a book 2 days ago from Amazon and it came yesterday morning. I thought, how is that possible? I don't understand. But it's kind of gratifying. Oh, look, the book's here. But come on, we're talking about human beings here, and we're talking about not just solving, super
content problems.
We're not just making people feel a bit better. We're actually talking about growing human beings.
Right. Teaching them coping skills, which you can't just give them like a skill list, because we know when emotion comes online, again, old things that have been recorded, when new things haven't been re-recorded over it, are going to become activated. And that list of things you just handed them is going to go right out the window.
But I used to love that one. I love John Gottman, and we used to watch tapes together, and I watched one where this couple had learned all these coping skills for conflict, and they taught them all, and they'd learn them all, and then they basically said, okay, now do them. And the couple went through the exercise, and they did them, right? And then somebody in the couple turned and said something to the other person that was triggering, and they went back to the way they were before, of course, because your amygdala doesn't give us stuff for your list of clever little tips. Your amygdala says, you're scared now, and react the way you've always reacted. That's the only thing, go. Right. And of course, that's what we do. But so, yeah.
To survive, and attachment is survival.
Well, the point is for me that what matters, the issue is not length of therapy. EFT is amazingly efficient, and we've shown that in research study after research. The point is for me, are you on target or not? Are you on target? What does this client need? And are you on target? And if the client says to you, I'm trying to think through the years. Oh, if the couple says to you, we know that we'll never trust each other again. We'd just like for you to do a few sessions so that we can basically understand what we did to each other and what happened, and we can make a clear story so that we can feel somehow closure. And yeah, I can do that in a couple of sessions. I think I saw them 3 times. Yeah, I can do that. If somebody says to me, I've been labeled this thing I don't understand, borderline. Could you help me understand that? Yeah, I can do that in a couple of sessions. That's the silliest diagnosis I've ever heard. But anyway, we won't go into that.
I write that in my book. What are we on the border of?
Yes, that's the silliest diagnosis I've ever heard. But anyway, yes, I can go into that because people use it to stigmatize themselves. There's a new one now. There's a new one now called prolonged grief. When will these committees stop coming up with strange words for human experience that makes half of us feel ridiculous. It's
like we keep telling people to shut down their humanity, to avoid, to numb it out, but then we wonder why people are more stressed, more anxious, more alone. And yet for all the science that we have, nobody's like linked the dots that maybe shutting down our humanity isn't such a good thing.
Well, to change the level just for a second, if what we decide is to not know how to deal with our deeper longings, needs, fears, and if we decide that to shut down, which means we shut other people out, I think that our democracies, our societies, and our planet won't be around for much longer. And that's the truth. So this then becomes bigger than therapy. It becomes, who are human beings? Can we understand human beings? Attachment science is the only scientific theory I know that answers those questions.
And it's very holistic.
Yes, who are human beings? How can we deal with the vulnerability involved in being human in a positive way? How can we connect with others, right? These are huge issues that have political ramifications for society. So in a way,
but also
it's not
on what you're saying. I just want to catch you while you're in that place. I think also what we notice is people, and we notice this in couples therapy, is that when we have insecure attachment and we don't know how to lean on and rely on another to help meet our needs, then we try to meet our own needs, and it can become a competition where I put myself first. And I notice both people always feel like they come in last in that place. And so we have a society where, all these quips on social media and all these memes that say, oh, you can't trust other people to meet your needs or be there for you, need to do it yourself. And so we end up putting ourselves first and not caring about other human beings. And we, it's stoking a lot of selfishness. There's
a lot of confusion about that.
Yes.
The bottom line is, from my point of view, and I'm not the only one who's saying this, governments are saying it, okay? There's two pandemics that we've been going through, and one was brewing for years and years and years. There was COVID, and it was interesting that the way most people dealt with COVID, most governments, was to shut everything down and shut people away. There's COVID, and then there's a pandemic called isolation, which Western societies have been infected with for decades, and which now I think has become, why in Western societies with more to eat and arguably more safety, if you take the long term over history, why are rates of depression and anxiety skyrocketing and PTSD? Why has the World Health Organization said that the biggest health problem that we're facing in the future is depression? Are you joking? What is that about? It's about disconnection. And what we do in EFIT, emotionally focused individual therapy, is we help you create a secure sense of connection with yourself, with your longings, your fears, your needs, in a way that helps you create a secure connection with others. What we did in couples therapy was we helped people create a secure connection with others in a way that fed the secure connection with self.
It's a system.
Yes, without that, the most basic thing that attachment science said is human beings are not biologically built. Human beings are not built for emotional isolation. They don't do it well. Right. They mess up. It's not a feasible life strategy, so this is a very interesting one, right?
And just to circle back, basic attachment 101. And part of, I just love what you're mentioning about, the world and sort of politics is just, back to EFIT, is that attachment is all about understanding how we human and helping people human better in the world. And we're seeing the effects of lack of secure connection on individuals, on societies, the way it affects our functioning as a society, and which, again, being a system, a feedback loop, it trickles down to our clients and ourselves who have to interact within the world. And so
I want to go back a bit, because I'm hooked on what you were talking about, which is about fast change.
Like instant fix. Clients come in, it's like the customer is always right. Make them feel better.
Instant fix is about superficial change.
Yes.
Right. So those therapists are right. EFIT and EFT isn't about superficial change. EFIT and EFT is about the fastest, most efficient, and most on-target way of creating incredibly significant change.
Yes.
That changes how people define themselves, how they deal with their vulnerability, and how they connect with others. And that is a lot of change, a lot of change, and a lot of significant change to put into 20 hours, 15 hours, even with someone with severe PTSD, 40 hours. That's a lot of change to put into there. So, but it depends. If therapy is just about giving advice, I honestly do feel that our days are numbered. We're going to be, already every talk show host tells us how to live our lives. Okay, every talk show host,
and they don't do a very good job of it. Again, look at our depression, right? Where our highest rates are depression, but we keep handing out these quips about how everyone needs to be self-sufficient, and we're dismantling the connection among humans.
Well, what I say, and people don't like it, I guess, what I say is the only self-sufficient human being is a dead human being. We are not built for self-sufficiency. Right. We are social animals. We are social. Why did we?
Even evolutionary science would agree with you there.
But why did we? Look at us. We're pathetic. We're naked. We don't have any fur. We don't have long fingernails. Our teeth are useless. I mean, we're like basically weird defenseless animals that developed a big brain. Why did we ever get to the top of the chain? Well, it used to be, it was our brain. Don't you know it was our brain? But now people are saying, no, it was the fact that we learned to communicate with each other and to send signals, and we developed language, and we learned to connect and protect and stay close and work together. That's why we're the top of the evolutionary chain. Well, and the animals who do best also do that. Crows. I'm just putting out a story in the next few weeks, which is a fairy story, which is new, that I wrote for my granddaughter, which is called Edgar and Eloise. And it's about all these things. It's about how you define yourself and how you deal with your emotions, particularly fear, right? But really, I got caught in it because I read this book on crows, on corvids, and how they have this tiny, tiny brain, and they can reflect and solve problems and do all these things you just can't imagine a bird doing. And one of the wonderful things about them is they're highly social. They protect each other. They take care of each other. They stay in families for like years and years and years. They mate with one mate. This is fascinating. So, part of how we've evolved is that we learn to connect. And the scary part, I think, about what's happening today in our societies is it feels like we are propagating disconnection from ourselves and from others at such a rate, and we don't even know what we're doing. How are you supposed to feel good about yourself in modern society? You're supposed to stand up in the morning and look in the mirror and say, God, you're wonderful. I'm sorry, this doesn't get you past coffee. This will only last until 9:15. And then the minute you get a look from somebody else that doesn't look approving, you're stuck. It's
right. And I have clients who stand in front of the mirror with their affirmations, and they say, I've tried these because I saw it on TikTok. And I was like, and are you buying what you're selling? And they're like, no, I don't believe it.
Well, yeah, that's right. And that's great. I love it when my clients say, I don't think so. I've been doing all these exercises, and you see, the issue is there's some good stuff out there. Mindfulness. You can use mindfulness in the most positive way, and for some people, it's a spiritual exercise. For some people, it's anxiety reduction. Great, right? And if it helps you grow, that's fantastic. And if it helps you connect with the bigger universe, that's fantastic too. We need that, but we also need a psychotherapy that can help us grow and connect with ourselves and other people, that's on target and effective and goes to the heart of the matter. That's what we need, whether it's EFT for couples or EFT for individuals.
Yeah, and that's it. So just bringing it back. So EFT, again, when we say EFIT, we're still talking about the model of emotionally focused therapy.
Yes.
When we say we're applying it to individuals because we know just one person is coming into the room, and that's who we're working
with their cast of characters with them.
Right. And EFT is non-pathologizing, and attachment is the science. It's not just a theory, it's a science through which we understand. So it gives us like X-ray vision to understand on a deeper level the human who comes into our room and why they're stuck. Not because, again, we know people with secure attachment are generally able to solve their own problems and don't tend to get stuck. So how did they get stuck? And we don't just want to administer superficial band-aids to get them through the moment. We're trying to change the system. How is it that they got stuck? The process that they arrived at, not being able to make their own decisions, not being able to handle with what's happening. And we help them learn how to handle their own problems by going through the system and changing the system. So it's a system change, and rewiring takes time. And we work on the emotional level because we know emotion, it's like that moldable clay, where we know that the nervous system is activated, and that's where the body hits record. So if they need to do different behaviors, we know from neurological science that we need to work with emotions, because you can't think logically. If you wanted, your prefrontal cortex floods with peptides and shuts down. So we need to help them work on the emotional level to build new muscle memory so the body can re-record some new strategies there. And attachment just helps us understand, even if they come in for something not to do with relationship, but, human beings, again, as you so aptly mentioned, we don't exist outside of each other. And so, I may have clients that come in with issues, and, and a lot of therapists get stuck here, and they're like, well, they have no social circle. And so I'm like, I'm curious, how did this person become so alone in the world that they don't even have family, siblings,
aloneness,
partner?
Aloneness is debilitating. Yeah. And that's the truth. Aloneness, real aloneness. Some people can live alone and they have a cast of loving characters in their head. Mm-hmm. They maybe have a relationship with a loving God that I would call attachment. They can live alone and they're okay. But many, many, many of us, we live in relationships and we're still emotionally alone. And that is problematic.
Well, and there's a difference between being by yourself and being alone, right?
Yes.
And attachment has that working model of self and others. So, like that view of other, we can still relationally soothe by ourselves. It's like a file we access. So, when a person comes in our room, we're going to be trying to understand what they're bringing to our door through the lens of humanity and how they got stuck and how to help change the system.
Yeah, and how they got stuck.
Yes.
Not what label of what not what these labels say about them. It's like you can talk to me about anxiety and another person can talk to me about anxiety, and they can be totally different phenomena. When do you feel anxious? What do you do with it? It's a totally different thing, right?
And we can't just coach them into new moves. Again, this comes back to working on the emotional level. I've seen therapists like, well, I just tell my client, like, you just need to not worry about what your mother thinks, and you need to go apply for law school, or you need to do this. I'm like, if that worked out already for them, I think they would be doing that. We need to work on the emotional level. We need to get into the blocks, because that's what's driving the show. So we got to work on that level and help them. What would you say our goal is? To help them be more functional? How would you describe?
We're helping people grow. We're helping people connect with themselves, with their needs, their longings, their fears, in a way that they're not overwhelmed, that they're in emotional balance. We're helping people grow. And when people can have this secure connection with self and with others, we know from all kinds of thousands of studies that people are resilient, they can make good decisions, they can change their behavior, they can grow. And so this is really significant change.
Yes.
And that's what we want in EFT.
And
we
an
don't just want
attachment,
something superficial.
and attachment 101 point, I want to make sure we mentioned while we're right here. I know we're going to be rounding out here in a moment, but we keep bringing this by is independence and dependence are two sides of the same coin. Right?
Yes. The ability, all the research says, the ability to be truly connected then allows for the ability to be truly separate and independent. What many people call self-sufficiency is simply shutting down or trying to shut down your needs for connection, shutting down your vulnerability and saying, I'm just fine, thank you very much. And that's very, very fragile. And we know that that does not lead to good mental health and physical health. But our society has got very confused about this whole thing about dependence. I think the most useful way to think about it is that interdependence, all the evidence is that true strength does not come from denying your vulnerability and your need for others. The ability to reach for others is the biggest resource you have in life. True strength does not come from denying that. True strength comes from knowing your vulnerabilities and your longings and your needs and your fears and being able to take control of them, hold them, listen to them, make sense of them, and then move out into the world in a balanced way where you can get your needs met and where you can grow with another person, and grow into a really full social human being. That's true strength, not, the people in the movies, like what was the big one? I can't remember. They all merge into each other. The idea of the hero who doesn't need anyone, who goes off and takes down the world all by himself. I always used to watch those, and they were kind of fun on an action level. And then it would reach a point where my clinical brain would go, no, about now you'd have full-blown PTSD symptoms, buddy, and you'd be reaching for the bottle or having a panic attack or making a terrible decision. No. So, we got all confused about who we were and dependency and independence. And I think attachment can take us through that, though.
And the more secure attachment we have, the more independent we can be and be willing to take risks and explore ourselves within the world.
The strongest people are those who have a real deep sense of security with themselves and with others, right?
And from the neurological science, we know being able to access the emotional comfort of that loving, secure other, even if they're not physically with us, whether they are with us or not, still can have the same effect where it releases that pain blocking chemicals. Look, folks, some problems can't be solved. They just have to play themselves out. But with that secure connection, even neurological science says that connection and attachment can change how a person's physiological body experiences pain as it goes through.
That's right. So I think we've covered the whole universe, politics, attachment, and EFT pretty well, Dr. Belle. So maybe we should wrap this one up.
Yeah. So if you want to let folks know, where can they learn more about EFIT, EFT for individuals? Where can they sign up to take a training?
You can go to our ICEF site, www.iceeft.com. That's the International Center for Excellence in Emotionally Focused Therapy. And you can find all kinds of trainings in there. We're working a lot with PESI, who put up a lot of trainings. I have a master course coming out on EFIT soon with PESI. We have trainings on our site and on the PESI site. We have EFIT levels 1 and 2 with my wonderful colleague, Leanne Campbell. You can go on our ICEF site and see other trainers giving trainings in EFIT and in EFT. You can join one of your EFT communities where there's all kinds of them. They might have one in your hometown where you can talk to other colleagues and look at tapes and listen to, to each other about how to learn to do EFT. You can get the primer in emotionally focused individual therapy. There's a lot of stuff out there, and more is coming. Recently we've been teaching with Pessy, for example. There's an EFIT with grief. There's an EFIT with trauma. There's the masterclass. There's EFIT 1 and 2. There's us, and knowing us. Oh, and the big study on EFIT will. Hopefully it's all done, and apparently it's very positive, but writing up research, I don't do that anymore, but writing up research studies is a lot of hard work. So that's happening right now.
And all of the research for emotionally focused therapy in whichever modality that people are studying, it can be found on ICEFT, correct?
Yes, it can. Lists of studies and articles. And what I want people to remember is that when you look at all the couples studies, remember that in those studies, we've focused on couple scores. We merge the two together. But in fact, what you're looking at when you look at those studies is you're also looking at individual change, especially in the big attachment study. That's an individual variable. Depression is an individual variable, the way it was defined in the study. Anxiety and PTSD symptoms are individual variables, and they change too. So, you can look at the research. There's lots of training tapes out there.
You have a book on EFT and trauma.
Yes, we have. Oh, that's old, and it's one of my favorite ones. My husband still says he likes that best of all the books I've ever written. I think it's because I wrote it on a beach. I didn't have all these in New Zealand. I didn't have all these books behind me to confuse the matter. So I wrote it on a beach. But that's a good one. And we're going to put out another book on EFIT and trauma, I think. So just because that's what we do, we keep doing studies and looking
so
at
ICEFT.com, so folks can sign up for training, find information about the research, even find out about communities in their areas. We also have lots of resources on Facebook to get involved with an EFT community near you. Right. And do you have a website also in addition to ICEFT?
I have Dr.SueJohnson.com.
Perfect.
And people can look on there, and that's kind of more geared to the public. And I can't even remember what's on it, to tell you the truth. But it's got all kinds of neat stuff on there that, kinds of tells people what's current and what we're doing right now. And soon I'll have my little fairy story up there, Edgar and Eloise, which I hope people will buy.
That's awesome.
One of the reasons I wrote that book is to fund immunotherapy research, which is immunotherapy research is the way of the future in medicine. Most of us will need it at some point in our lives. And so I feel very strongly about it. And so I didn't know how to contribute to that research. So I wrote a fairy story. That's isn't great. Really a fairy story. It's about us all. But anyway, whatever.
I think it's
fairy stories are really about us all. Yes.
So I'll make sure that I put links to all of the websites in the description for the video on YouTube. If you're listening in podcast form, you may just have to rewind the tape and take a note. And you can also purchase Sue's books on Amazon as well. And her most recent, a primer for emotionally focused therapy with individuals, correct, is the name?
That is right.
Find that. And she also has Attachment Theory in Process.
No, Attachment Theory in Practice. That's right. That's a very sort of serious book talking about how attachment science is the holy grail for therapists, and if we ignore it, we're very, 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 very silly. That's what
sounds like it's seriously good then, Sue.
Well, I like it, but that's because I'm a bit biased. But there you go. Yes, it's a book that basically says whether you're working with families, couples, or individuals, it's a craziness to ignore this map to who we are as human beings. If you're going to try to grow human beings, if you're going to try and grow human beings, you have to know who they are.
Absolutely. Thank
you, Annabelle. It's been very fun talking to you.
Thank you again so much, Sue, for being on. And folks, just remember to go to Sue's websites and ICEFT. ICEFT is the founding regulatory body for emotionally focused therapy, and you can become a member and get discounts on training videos. And it is the official body for training in emotionally focused therapy. So please make sure you check it out and become a member. And again, If you're interested in EFT, I hope that this video will help you. Again, we're not supposed to say that any model is a one size fits all, but EFT, I think, comes seriously close, and it's a one size fits most because, again, attachment is universal. So, and it has a map of how to help couples, and it's been rigorously researched and has a lot of outcome studies. So you can find all the research on ICEF.com. And again, I will put links to that on the website. Thank you again, Sue, for being with us and just for your amazing body of work and creating this wonderful model.
You're most welcome.
And thank you to our viewers. Make sure that you guys hit subscribe because more videos are on the way. Don't forget to buy my book, Using Relentless Empathy in the Therapeutic Relationship, Connecting with Challenging and Resistant Clients for Helping Professionals. Available on Amazon or on my website, www.drbugatti.com.